Thank you very much. This is Dr. Okwada, the chairperson of NUCHO. NUCHO is a CBO in Northern Uganda. It's called Northern Uganda Community Health Outreach in collaboration with NUV-HOP, which is Northern Uganda Village Health Outreach Project from Belgium. This is one of the projects which has been in existence for the last I think it's over 15 years, from 2012 up to now. It has been in collaboration with students from Gulu University and other partners which are locally, contracted from within this sub-region. At the same time, we also brought on board other new partners, including Sickle Cell. And this time around, in July, starting on the 8th up to 29th, we shall have another mega project, including more integrated community outreaches, where we shall have medical consultation, we shall have laboratory services, we shall have treatment, we shall have community engagement and sensitization, and lastly, we shall have family planning, including as well sickle cell screening and testing. And those are not the only services that we are going to offer. We are also looking at how we can, do more of health promotion in terms of water supply. And that's why we also have another mega collaboration coming in with Umasol, which is going to provide us with safe water for these communities that we always serve. But specifically, I would like to, add one more important information, more especially in one of the neglected, condition which has been prevailing in Northern Uganda, that is sickle cell disease. We have realized that many of the community members still don't know more about sickle cell. Others believe they are bewitched. Others believe that it's a curse from, from God, and others believe it's as a result of the effect of the war that was in this region. But sickle cell has come to the rescue to disseminate information, to make people know that this is a disease which is genetical and you can pass it on to your next generation. So it's always very important for you to do testing. If you know your status, it can guide you in future on how we can, manage this condition and how we can prevent this alarming numbers of conditions which are coming in this region. Otherwise, I would like to say community should get ready and prepare themselves, because this time around we are coming as a big team, bigger than what we have ever had before. Thank you very much.